Good afternoon, Chair Greenlick, Vice Chair Nose, members of the committee. My name's Ellen Rosenblum, and I'm Oregon's Attorney General. I'm here to testify in support of House Bill 2114. As Oregon's Attorney General, I am a member of the National Association of Attorneys General, also called NAG, unfortunately. As a member of this association, I attend briefings on the issues we attorneys general view as a common problem across all states, regardless of political affiliation, urban-rural divide, or physical location. Opiate addiction is in the very highest category of areas of shared concern among all attorneys general. I would say just about every meeting I've attended during the last 4 years, there's been some kind of a presentation on this topic by one or the other of the states, or often a group of the states. Abuse of both pharmaceutical and illegally derived opiates is spreading like wildfire across our country, and Oregon is one of the states hardest hit by this epidemic. Opiates have been a recognized and medically sanctioned method of pain management for hundreds of years. The medical use of the opium poppy predates industrialized society, and the World Health Organization recognizes the innumerable benefits of controlled opiate ingestion for many patients with pain-related conditions. Unfortunately, we've learned that even when used as directed, the risk of overdose and addiction has reached unacceptable levels. Nationally, from 2000 to 2014, nearly 500,000 people died from drug overdose. The rate of prescription opioid overdoses has quadrupled since 1999, and the numbers continue to climb. In 2015, opioids killed more than 33,000 people in the United States, the highest number in history. We have every reason to believe that this dark number, which has been elevated repeatedly across recent years, will only grow higher without a targeted intervention effort designed to reduce the ready supply of this useful but also potentially lethal substance. Here in Oregon, prescription drug overdoses resulting in death more than doubled between 2000 and 2011. Besides the tragedy of the lives lost, we also pay the innumerable healthcare costs associated with opioid abuse and addiction, including the inevitable use of emergency medical services. According to the U.S. Department of Health and Human Services, emergency room visits for opioids increased 114% between 2004 and 2011, with 24 to 27% of those visits resulting in subsequent hospitalization. In Oregon, the frequency of ER visits and reliance on these very expensive medical services is even higher. While this problem is certainly complicated, encompassing our medical systems, our criminal justice systems, and other important links in the broader chain of social service delivery, solutions exist. One component of this solution is to reduce and control the prescription of pain medication. This will in turn work to control opportunities for the accidental creation of new addicts. The Center for Disease Control has issued guidance to prescribing physicians, making clear that, except in unusual cases, the prescription of opiates for the purpose of managing acute pain should be limited to less than a week of supply. However, and despite these clear guidelines, we are still seeing the routine prescription of substantially larger supplies of opiates for the management of pain in very conventional cases: root canals, small surgeries, pulled muscles. In 2014, enough opiates were prescribed in Oregon for nearly every person in the state to have their own bottle. Because of the profound feeling of relaxation and wellness that can accompany the consumption of an opiate, an oversupply will often be consumed by the patient until the supply is exhausted and the risk of addiction vastly elevated. Even a patient who voluntarily ceases her consumption of opiates prior to exhausting her prescription may simply leave the unused pills in her bathroom cabinet, where they will sit, often unattended, presenting an easy opportunity for diversion into the lucrative underground street market, where these pills are sold for 5 to 10 times their retail price. This helps to explain why some experts estimate that the illegal trafficking in prescription drugs may now be a billion-dollar industry. House Bill 2114 will reduce the risk of abuse, diversion, and addiction by reducing the number of opioids in circulation. House Bill 2114 requires any prescribing physician to limit an initial prescription for an opiate used for pain management to 7 days, consistent with the outer limits already designated as appropriate by the CDC. If a prescriber wishes to prescribe an amount in excess of 7 days, they can do so. They are required only to document the reasons for this decision. In 2013, an Oregon task force convened as part of the National Governors Association Task Force on Prescription Drug Abuse issued a number of recommendations, including that we need fewer pills in circulation, noting that, quote, the focus of Oregon's approach should be on changing prescriber and patient behaviors so there are fewer prescriptions for fewer pills. I agree. House Bill 2114 will reduce the number of pills in circulation subject to abuse or diversion. This means there will be fewer pills left over after a surgery or medical treatment that can end up in the wrong hands. House Bill 2114 also reduced the risk of accidental addiction. Accidental addiction ruins the lives that it touches, and the tragedy is the ease with which a person can become an addict simply by taking one pill a day, just like the doctor tells you, until the supply runs out. Importantly, House Bill 2114 still leaves the judgment call to the doctor and does not force a particular result. They just have to note in the patient's chart the specific reason for a longer dose. This fairly balances the need to respect the sanctity of the relationship between doctor and patient with the larger social interest in curbing the oversupply of opiates, not just on our streets, but in our bathroom cabinets. Finally, House Bill 2114 will protect our children from opioid addiction by requiring prescribers to have a conversation with parents or guardians about the risks of opioid use while adhering to the same 7-day limit applicable to adults. Ending Oregon's opiate addiction is about the curtailment of both supply and demand, preventing pills from diversion to the illegal street markets, and working to prevent the creation of new addicts. And this bill does both. So I do want to thank you for the opportunity to testify. And we are open for questions, and I want to apologize. I missed acknowledging Vice Chair Representative Hayden. Thank you.